Welcome back to StartUpHealth TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. I'm here with Ryan Lee, CEO and co-founder of HireMe Healthcare. Thanks for joining me, Ryan.
Thanks for having me, Logan. It's an honor to be here.
So you've got an interesting new take on helping to tackle the nursing shortage through kind of a matching software. So tell me what you've built.
Yeah, so the nursing shortage is a multifaceted problem. It has many reasons. I mean, of course there is a talent shortage. You know, it's hard to find nurses. We don't have enough going through the educational pipeline. There's a lot of components of it. But what we set out to tackle specifically is the issue with retention. You know, 100,000 nurses left the field last year. Hundreds of thousands more leaving, that are set to leave in the coming years.
So there's two parts of the retention problem, I'm guessing. There's leaving the field, and then there's also leaving your job.
Right.
So what are some of the drivers and market forces contributing to that?
You know, a lot of it just comes down to the lack of satisfaction in the job, which for us is about fit. And finding the right fit for a job will make you more likely. You know, there's a lot of drivers. There's the number one driver that was sending nurses from permanent placement to travel. Do you know what it was during the pandemic? Most people guess money, but that was actually number 4.
Really?
Number 1 was career development and personal growth, and travel allowed that. You know, don't put us in a box this big. Allow us to expand. You know, nurses just like anyone else, just like all of us here at Health. You know, they want to grow in their profession and in their careers and personally too.
So how can a platform like yours fix that problem?
Well, we say that Match.com and ZipRecruiter just had a baby and it practices nursing. Because what we like to do is to simplify, expedite, and most importantly, humanize the hiring process. Okay. And so what our technology does is it matchmakes nurses for these roles, ranking candidates based on fit. And what we're building right now, and the big part of what we're raising for, is to continue building out that matching towards the qualitative side, to find the people behind the paperwork. And we've heard from both sides how badly they just wish they knew more about each side before. You know, you're not just hiring X person on paper for Y team in this place. You're hiring, Logan the nurse to come work for Ryan and his team and his unit, and that's going to vary in any situation. So we're looking to add those human aspects in. We take pages from the dating book playbook for this, qualitative questions. We're looking to build out more vocational testing and even have potentially psychometric testing down the road. These are the things that we have in our pipeline, which are really exciting. Yeah. And that's what we're doing.
Why have some of the newer nursing hiring tools fallen flat? And there are platforms, I'm guessing, it's a big market, and yet they still haven't quite solved the problem. Yeah,
the passive platforms that everyone uses, ZipRecruiter, LinkedIn, Indeed, those, you just have jobs just sitting there, and it's kind of like just build it and they will come. Just set something here, hope someone finds it. Maybe they'll stumble upon it, walk up, but that's obviously not working. There are great active platforms out there that do good work. Incredible Health, for one, is good at what they do, and they match people very well. They have a great footprint. I think the big differentiator and what's falling short, because it really comes down to focusing on fit, and it really matters to pair a nurse based on their goals. So take, a nurse spent 15 years in an ED. And that looks like, and they have intensive care experience. That looks like a perfect candidate for an ED job, right? Well, what the resume is not going to say is that nurse is actually fed up with the hustle, wants something more primary care related, something to settle down a little more. And usually that opportunity can only really come out in the application process. She could spend a lot of time applying over and over to these new jobs, filling out numerous applications. On HireMe Healthcare, we can matchmake that, and she can one-click apply to any job like that stands out to her, she can be recruited.
Yeah, how would you go about kind of sussing out those non-traditional aspects of her desires?
Questions is a big part of it. Asking them. It's a little more work on the front end, of course. We acknowledge that, but it's kind of like the way Hinge works. Hinge allows you to select, here's 58 questions or whatever, pick 5 that you think most highlight who you are as a person and answer them.
Interesting.
And Hinge leads to lifelong marriages all the time. Right now, hiring platforms lead to 90-day stints.
Interesting. Okay, talk to me about why this is good for hiring managers. Obviously, if I'm the nurse, then I want to find a better job so that I, can build a career there, and I find a place that cares about my, career development. What about on the hiring manager and the hospital side?
Yeah, so for the hiring manager, we say that this gives you the reach and efficiency of a recruiting firm without having to pay all the recruiting the recruiting costs, and you get to do it yourself. The people that know the best. Who knows better how to staff a unit than the hiring manager that oversees that unit, that works with these folks on a regular basis and knows the personality, the ambiance of the position, if you will, and what kind of person that would click well here. Sometimes a person who's really energetic and jumpy might not be jumpy. Energetic and just all about that serious hustle. You might have a more laid back floor, and that wouldn't necessarily be the perfect fit, but that perfect fit does exist somewhere else. And that's what we're looking to find more. It's about the people.
Yeah, I would imagine your go-to-market would be all about great partnerships with organizations, hospital systems, nursing organizations. What message would you hope, if one of them were watching this, to take away from what you're saying?
I would just want them to take away that staffing and agencies have had their time, and a lot of what is being done out there is falling short. Innovation that can save time and money is the future, but the only way we're going to figure this out is if we all look together at the humans. Hiring, at the end of the day, is a human process. I know it sounds ironic to use technology to solve a human problem, but we think that by really looking at who these people are, what these people desire, we can find these matches. And if you find a job that you were supposed to be in, you're way more likely to stay. You've been in your job for a really long time. Why? Because you like it, because you're a great fit for it, as we see with you as a host.
Yeah. Thanks. Yeah. Are you seeing a generational shift? Obviously, like, some nurses are very young now. I know. They could be 24, 25. You got like a TikTok generation coming into nursing, and they're expecting a certain type of technology. How are you seeing that shift the whole landscape?
The population, just like the regular population, the population of nurses is aging right now, and that's another concern for the staffing situation. But we do have these incredibly promising groups of young nurses coming through, and right now a big issue is that the number of qualified candidates for nursing school greatly outnumbers the number of seats in nursing schools. It's also understaffed. And some of what the Biden administration recently passed is set out to address that. Now we'll see what that actually pans out. This is legislation that just passed over the summer, but it's looking to tackle this pipeline issue. But more to your question, that generation that is coming out, they do want to see new technology. They want to do everything on their phones. Have you ever tried to get a Gen Z to leave their phone? Yes, you have. You have kids.
And they don't have phones yet, but
not quite.
When they do, it'll change everything. Ryan, I appreciate the update. Love this idea of Match.com, ZipRecruiter gets into nursing, put it all together. It's an idea that's going to make a lot of sense for a lot of people. Be very intuitive. Hopefully, help to alleviate some of that nursing shortage burden. That's both on the provider side as well as it's hurting patients, it's hurting hospitals, it's this multifactorial problem. So I'm glad you're working on it.
Thank you, Logan. That is the thing. It comes all the way back down to patient outcomes. Every single one of us is impacted by this. And that's why we all got to work together to address it.
Thanks for the update, Ryan.
Thank you, Logan.
Appreciate it. Best of luck.